Signs your liver might have built up fat. Your liver is an important organ that helps your body's metabolism, get rid of waste, and stay healthy generally. There is a sickness called fatty liver disease that can happen when fat builds up in the liver. This problem can be mild to severe, and if you don't treat it, it could lead to major health issues. There may be fat on your liver. Here are some signs and what you can do about it. 1. Fatigue. Being tired or worn out is a typical sign of many health problems, including fatty liver disease. Being overweight can stop your liver from working properly, which can lower your energy and make you feel tired even after getting enough rest. 2. Abdominal discomfort. People who have fatty liver disease may feel pain or discomfort in the upper right side of their belly, which is where the liver is. The pain may get worse after eating fatty foods and can range from a dull ache to a sharp pain. 3. Swelling. When you have edema, or fluid retention, in your legs or belly, it can mean that your fatty liver disease is getting worse. If the liver isn't working right, fluid can build up in the body and cause the legs or belly to swell. 4. Jaydenitis. This is when your skin and eyes turn yellow because your body has too much bilirubin. Bilirubin is a waste product that the liver makes. When the liver doesn't work properly because of fatty liver disease, bile can build up and cause jaundice. 5. Changes in stool color. Fatty liver disease can also have an effect on your gut system, which can cause your stool color to change. If you notice that your stools are lighter than normal, it could mean that your liver is having trouble making and moving bile. 6. Loss of appetite and weight loss. Some people with fatty liver disease may lose their appetite and gain weight without meaning to. There are many things that can cause this, such as changes in metabolism and liver function getting worse. If you have any of these signs, you need to see your doctor right away to get checked out. Most of the time, fatty liver disease can be found through blood tests, imaging studies like an ultrasound or MRI, or a liver biopsy. People with fatty liver disease usually need to make changes to their lifestyle, like eating better, working out daily, and not drinking alcohol. Sometimes, medicines are given to help control symptoms or lower the risk of problems. If you pay attention to these signs and get medical help if you experience them, you can protect your liver health and lower your risk of getting other problems that come with fatty liver disease. Remember that finding and treating this problem early is the most important thing you can do to keep your health and well-being in general. How does the liver get fat? When there is an imbalance between how much fat the body takes in, makes, or stores and how well the liver can handle and process it, fat can build up in the liver. A lot of fat can build up in the liver for a number of reasons, including the buildup of fat in the liver can be caused by a bad diet that is high in unhealthy fats, sugars, and processed foods. 1. Too many sugary drinks and foods, along with diets high in saturated and trans fats, can make it hard for the liver to break down and handle fats properly. 2. Obesity. Being overweight or obese makes you more likely to get fatty liver disease. Fatty acids and triglycerides can build up in the liver when there is too much body fat, especially visceral fat, fat that is stored around the organs in the abdomen. 3. Insulin resistance. Cells in the body stop responding as well to insulin, a hormone that controls blood sugar levels. This is called insulin resistance. It is possible for insulin resistance to cause high insulin levels in the blood, which can help the liver make and store fat. 4. Type 2 diabetes. People with type 2 diabetes are more likely to get fatty liver disease. Diabetes causes blood sugar levels to be too high, which can make fat build up in the liver. 5. High blood lipids. Fatty liver disease is more likely to happen if you have high amounts of cholesterol and triglycerides in your blood, which can be caused by conditions like hyperlipidemia or dyslipidemia. 6. Drinking too much alcohol. Drinking too much alcohol can cause alcoholic fatty liver disease, a type of fatty liver disease that happens when alcohol damages liver cells. Abusing alcohol for a long time can make it harder for the liver to break down fats properly, which can cause fat to build up in the liver. 7. Genetics. Some genetic factors can make someone more likely to get fatty liver disease, even if they don't have any other risk factors. Differences in genes can affect how fats are broken down and processed in the liver. It's important to remember that not all fat buildup in the liver is due to the way people live. Some people may get fatty liver disease because of their genes or other health problems they already have. No matter what caused it, changing risk factors like food, exercise, and alcohol use can help stop or control fatty liver disease and improve liver health in general. What should you eat to keep your liver from getting fat? Eating well is very important for keeping the liver fit and stopping fat from building up. Some food rules that can help keep the liver from getting fat are listed below. Eat a lot of fruits and vegetables. Fruits and vegetables are full of fiber, vitamins, minerals, enzymes, and other nutrients that are good for your liver and overall health. Try to eat a wide range of colorful fruits and veggies to get all the nutrients you need and help your liver work better. Choose whole grains. Instead of refined grains, choose whole grains like oats, brown rice, quinoa, and whole wheat bread. Fiber, which is found in large amounts in whole grains, can help keep blood sugar levels in check and lower the risk of fatty liver disease. Include sources of lean protein. Eat foods that are high in lean protein, like chicken, fish, tofu, beans, and other vegetables. When compared to red meat and processed foods, these protein sources have less saturated fat. This can help lower the risk of fat building up in the liver. Cut down on trans and saturated fats. Cut back on foods that are high in saturated and trans fats, like fried foods, processed meats, fatty meat cuts, butter, and dairy products that are full of fat. It is possible for these fats to cause fat to build up in the liver and raise the risk of getting fatty liver disease. Choose healthy fats. Instead of eating saturated and trans fats, try eating healthy fats like those in olive oil, nuts, seeds, eggs, and butter. Essential fatty acids found in these fats help keep the liver healthy without making fat build up. Limit drinks and foods with added sugars. Cut back on drinks and foods that have a lot of extra sugar, like soda, candy, pastries, and snacks that are sweetened. If you eat a lot of sugar, your body may become resistant to insulin, which can cause fat to build up in your liver. Watch portion sizes. Pay attention to portion sizes to avoid eating too much, which can make you gain weight and raise your chance of fatty liver disease. Pay attention to your body's signals for hunger and fullness, and eat mindfully to avoid having too many calories. Stay fresh. Drink a lot of water throughout the day to keep your body fresh and help your liver work properly. Limit how much booze and sugary drinks you drink, because they can hurt your liver and make you gain weight. Limit the amount of booze you drink. If you do drink, do so in moderation. Women should not drink more than 1 drink a day, and men should not drink more than 2 drinks a day. Drinking too much alcohol can lead to fatty liver disease and other liver-related illnesses. Maintain a healthy weight. A healthy weight is something you should aim for and keep by eating well and working out regularly. Getting rid of extra weight can lower the chance of fatty liver disease and make the liver healthier in general. By following these food rules and living a healthy life, you can protect your liver, lower your chance of fat building up in your liver, and improve your overall health. If you're worried about the health of your liver or need personalized diet advice, talk to a doctor or trained dietitian. What are 3 things that someone with a fatty liver should eat? If you have fatty liver disease, it's important to eat foods that are good for your liver and help keep it healthy. For people with fatty liver, these 3 foods are good for them. 1. Leafy greens. People who have fatty liver disease should eat a lot of leafy greens, like spinach, kale, collard greens, and Swiss chard. Antioxidants. Vitamins, like vitamin C, vitamin K, and folate. And minerals, like iron and calcium, are all found in large amounts in these veggies. They also have chemicals in them that help the liver get rid of toxins and keep liver cells from getting hurt. 2. Omega-3 fatty acids are found in large amounts in fatty fish like salmon, mackerel, sardines, trout, and herring. These acids help reduce inflammation and may also help reduce liver fat. Omega-3 fatty acids have been shown to lower cholesterol levels in the blood and liver inflammation, which can be good for people who have fatty liver disease. To get the health benefits, try to eat fatty fish at least twice a week. 3. Berries. Blueberries, strawberries, raspberries, and blackberries are just a few of the berries that are high in flavonoids and polyphenols, which are antioxidants that have been shown to protect the liver. These antioxidants help lower oxidative stress and inflammation in the liver, both of which are common in people with fatty liver disease. Berries are also low in calories and high in fiber, so they are a tasty and healthy addition to a diet that is good for people with fatty livers. In addition to eating these foods, it's important to follow other eating habits that are good for your liver, like eating less processed foods, added sugars, and unhealthy fats, and staying at a healthy weight by watching your portions and working out regularly. For personalized dietary advice and suggestions, talk to a doctor or qualified dietitian if you have fatty liver disease or are worried about your liver's health. Thank you for joining us on Herbalist channel today. We hope you found this video informative and inspiring on your journey toward better health and well-being. Don't forget to like, share, and subscribe for more videos on herbal remedies, health tips, and nutritious recipes. Remember, nature has provided us with incredible healing properties through plants, and we're here to explore them together. Until next time, stay healthy, stay happy, and stay tuned to Herbalist channel. Take care.